Many dermatologic conditions in skin of color tend to be diagnosed at later stages or sometimes misdiagnosed or undertreated. Historically, the amount of research and education pertaining to dermatologic conditions in patients with skin of color has been less than it has been for individuals with lighter pigmented skin.
There are significant differences in skin diseases in patients with skin of color. And if you don't understand the pattern of disease, the differences in colors of the rash, the difference in presentation of deadly skin cancers, then our patients are not going to receive the treatment that they need. They're going to be misdiagnosed, and that's going to contribute to morbidity and mortality.
It's important to know that the classic things that dermatologists are taught to recognize sometimes look different on darker skin tones. In particular, erythema or redness can be sometimes difficult to appreciate. Traditionally, our textbooks and other resources lacked images of people with darker skin tones. And that also made it difficult for people to really learn and understand how conditions present in people with darker skin types.
In patients with skin of color, the diagnosis may be tricky. Sometimes if the condition has inflammation associated with it, and typically in the textbook, it looks like a bright red dot on the skin. In patients of color, you may never see that. You may never be able to appreciate the erythema or redness at all, or you may appreciate a more purple tone. So the reason that it can be tricky to diagnose someone who has skin of color is because it really depends on what you were trained to do.
So for example, eczema, atopic dermatitis. Classically, in light skin, it's red, it's flaky. But in skin of color, it could have a dusky gray color and maybe not be raised. It could have little tiny bumps. But if you're not trained to look for those signs and know that that equates to eczema in richly melanated skin, you're not going to diagnose that patient properly. And then you're not going to treat that patient properly.
So there's this misconception that Black people, Hispanic people don't get skin cancer, which is totally wrong. In fact, we don't get it in the same proportion as lighter skinned individuals, but when we do get skin cancer, it tends to go undiagnosed or it tends to present and is diagnosed at a later stage, which can lead to poorer outcomes.
There's a particular type of hair loss that specifically affects African American women. It's called centrifugal cicatricial alopecia. It typically starts off as a small area and it spreads over time and it causes permanent scarring hair loss, and it's absolutely devastating for women who suffer from this condition. Unfortunately, there hasn't been a lot of research, and so we don't understand why it happens, and we don't have effective treatments for it either.
I treat patients with a very itchy disorder. It's called prurigo nodularis. And in Caucasian patients, it tends to be, very shallow, small bumps. In African American patients and Black patients, we see these very fibrotic, large nodules. And when my lab did some research on even the mutations underlying the disease, we found that they were actually dramatically different. The lesions are much more fibrotic. They can leave dyspigmentation.
I remember being a resident and being told that Black people just didn't get rosacea. Well, we all know that's ridiculous, and I think that has impaired people's ability to control a skin condition that can be debilitating and embarrassing and just, really a pain.
And I think it's really important that dermatologists and also other physicians are aware of differences in how these diseases that are dermatologic diseases present in skin of color patients. We want to really encourage, research and partnerships with industry to really spur studies to help those patients.
We also want to work with our payers to be able to improve access to new therapies for our patients, because too many times there are barriers in terms of economic barriers and insurance coverage barriers for patients to receive the care that they deserve.
There's been great progress, I'm happy to report, in terms of improving the training of young physicians improve the training of residents as well as medical students.
Thank God this has gotten a lot of attention in the past few years. And there are now atlases in development from experts and all sorts of collaboration, even with AI, getting into digital images and being able to recognize different skin tones.
Thanks to the efforts of the Skin of Color Society and other organizations in the dermatology field at large, we're seeing great improvements in our overall understanding of the unique features and unmet needs in patients with skin of color.